Hello, we're answering questions on health and medical problems. I'm joined by Dr. Rosemary Leonard. Rosemary, hello.
Hello.
We've got a question from a young lady wanting advice about cervical screening. Now, she says she's 25, she's perfectly fit, and yet she's received this invitation from the GPs, which all young women get these days, and older women have too. But she thinks, I'm fit and healthy, do I really need to go?
It depends whether she's had sex. If she's never been sexually active, then actually there is no reason for her to go for a cervical smear test, and she'd find it quite painful. But we now know that cervical cancer is caused by the HPV virus, the human papillomavirus, which is sexually transmitted. You only need one partner to pick up HPV, and it's a very, very infectious virus that transfers from skin to skin. And in some people, it can slowly cause the changes that gradually lead to cervical cancer, which is the whole point of the cervical screening programme, because you can pick up these changes early, have treatment, and then you haven't got a problem. So it really does prevent cervical cancer. I know a lot of women are worried about the process of having a smear test, but if you explain that it's the first one you've ever had, the nurse or the doctor that's doing it will do their best to put you at your ease, and it shouldn't be painful. It shouldn't even be uncomfortable either.
And if you're shy about the sex, if it's going to be a male doctor, you can ask for a woman doctor. There's often somebody else present in the room.
Yes, and nurses, in a lot of surgeries, routine cervical smears are done by nurses who are very sympathetic, and as I say, will really explain the procedure to you. And yes, you have to have an internal examination for it, but that shouldn't hurt.
They're usually very comfortable on the whole.
Yes, and it really can help to save your life.
And really how often should women have this kind of screening?
Well, it's changing according to your age, but generally younger women should have a smear test done once every 3 years, and then once you get past 40, assuming that you've never had an abnormal smear, then you have them done once every 5 years. But if you ever have an abnormal smear, you need to have the smear test done more often. But you can be advised on that according to the results.
Good advice. Thank you, Rosemary. If you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.